Right. This is Dominic Gomez, and I'm doing my presentation on lobotomies. Before lobotomies existed, psychiatric hospitals were overcrowded with patients, with populations tripling from the 1890s to the 1930s. Some treatments that could be viewed at the hospitals were forced restraint of the patients, electroconvulsive therapy, induced comas through insulin injection, amongst other harsh methods. Psychiatrists were growing frustrated with the overall state of the hospitals, and were searching for answers to alleviate this problem. Antonio Egas Moniz was a Portuguese neurologist who graduated from the University of Coimbra in 1899 with honors in medicine. He's famously known as the father of psychosurgery, and he performed the first lobotomy on a human in 1935. Moniz's lobotomy was termed the leucotomy as he used a tool called the leucotome, which could be seen in that bottom right corner. Um, Moniz believed that the brain could be rewired, and the way he did this was he would cut into the frontal lobes, cutting and severing the connections to the rest of the brain. He believed that quieting the mind was the cure for mental illness, and so by doing that, he found that as a positive result and helped people suffering from mental illness. And for his work, he won a Nobel Prize in 1949. Walter Freeman was an American physician and neurologist who also got his degree in medicine at the University of Pennsylvania Medical School. He began work at St. Elizabeth's Hospital shortly after graduating and became the first head of neurology there. He was really eager and excited about the idea of psychosurgery, and he claimed to be the one to specialize lobotomies and perfect the surgery itself. And the reason why he was so interested in psychosurgery was how he looked up to Antonio Egas Moniz, and he even got to learn under him for a bit. And a quote from Freeman is we stand at the threshold of a revolution in psychiatric care. If we can render peace to so many tormented souls, we must not hesitate. So in his mind, lobotomies was kind of the way to go to figure out this epidemic of mental illness, and that we shouldn't not do it. We have to keep going through and push through to help these people in his mind. Freeman was often accompanied by James Watts, who was an American neurosurgeon. The two worked on many reports and case studies together. Famously, Psychosurgery, which the first edition came out in 1942. And in these psychosurgery reports, they would discuss various patients and ranges of mental illness that they would see, ranging from schizophrenia to psychosis. And the two of them together performed estimated 200 lobotomies from 1936 to 1942. All right, the transorbital lobotomy was created by Walter Freeman. Why he wanted to do this was he wanted to come up with an easier way for people to perform lobotomies. So they wouldn't have to do it in an operating room. They could do it without an operating room. So psychiatric hospitals can just uh, get them going. Um, what it would do is they would use an ice pick like instrument and they would insert it through the eye socket of the patient, hit it with a mallet, which until it went through the frontal lobes. Claimed that they were successful. So Walter felt that his um, lobotomy was a success. Um, and that patients were able to walk and be able to carry conversations shortly after leaving the operating table. Some criticisms arose after the lobotomy was created. Many professionals criticized Freeman and other psychosurgeons for partaking in this surgery, as the procedure would cause irreversible damage to the brain. The success rates of the procedure weren't reliable, and it made patients change their emotional and personality. So like many of them that saw the positive in lobotomies, their idea was that changing their emotion and personality was a success because they would quiet them rather than from them being really agitated and fidgety and then going to just like nothing, no emotion, no personality. That was seen as excess, where a lot of the criticisms was going against that having no personality, even though it's hard to control them, that's not a positive for the patient. And how modern psychology can learn and relate to this is just by being more aware of the ethics going on with the procedures and different ideas that they have, and mostly just getting better consent, understanding that the consent is super important. Obviously, now it is very, very, very hard to get consent. It is very, very strict on how people get consent when running anything. Um, so that's how modern psychology can look at the era of lobotomies, and also how medication now can help aid certain mental health conditions, making it surgical free and making it more safe for the patient. All right, thank you guys.